68-year-old African-American male experiencing difficulty urinating. He presents to us today with a benign prostatic hyperplasia. He is having issues with, unfortunately, his prostate. He was informed last year by his primary care that he had the enlarged prostate, and unfortunately has not been back since. He presents today with a little bit of discomfort. He is uncomfortable and has some grimacing in his facial expressions. He is sitting in the hospital bed, shifting comfortably as I enter the room. He presents to us today with little urine output, and again, some discomfort in his abdomen. I suggest, or I think that it is from urinary retention. He informs us that he unfortunately has not had blood work done in a very long time, that he had not been back to the doctor in about a year for blood work and to get his prostate examined once again. He did inform me that he has been screened in the past for prostate cancer. However, he does not have any signs or symptoms of prostate cancer at this period of time. The doctor has ordered a Foley catheter to be inserted, and this patient does take Flomax as prescribed by mouth just to assist him with his urinary output. He has no known allergies at this time that he's aware of. The majority of his vitals are within normal limits, unfortunately, except for his blood pressure, which he does not take blood pressure medication. His blood pressure was 138/92, which is not normal. Unfortunately, it's regarding his discomfort with his abdomen. There was no abdomen tenderness or distension. He did have a little bit of tenderness in the pelvic area regarding his urinary retention. He again takes the Flomax every single day or daily regarding his urinary issues. Every time this patient goes to the bathroom, he unfortunately only has little urinary output, and it also hurt, and he also has pain every time he does urinate. I had suggested a catheter, a QMA, I'm pretty sure that's correct, a QMA catheter to empty out his bladder. I did suggest for him to get a bladder scan and to suggest the doctor to have more blood work ordered to see if there's any other underlying conditions. This patient does not have an extensive history regarding this situation. He does not take blood pressure medication, even though his blood pressure was a little bit elevated today. He said that this had started a few months ago, but he didn't think anything of it. Unfortunately, he has not been into the doctor regarding this issue, but we are going to suggest, again, him to get a catheter placement today after his bladder scan to see how much urine he has in his bladder that is causing this discomfort to him. And he did not have any symptoms as in pain, bleeding. He did not have any symptoms as in bleeding, fever, or anything else. His temperature was perfect. His pulse was perfect, and so was his O2. His O2 was on room air, and it was 95%. I recommend him, once again, getting more blood work done, just to make sure there's no more underlying conditions, and to also continue to see the doctor yearly, especially for his advanced age of 68. Him being an African-American male, for him to get the prostate exam yearly, just to make sure that we can prevent and avoid any other conditions to worsen.